up the micromotor. Here's the micromotor and the contra angle. Then, insert the burr. Okay. Inserted the burr already. Here. Adjust the speed. There we go. Hold the handpiece in 10-cut motion. And then, position it perpendicular. The teeth 2 mm above the tooth. Then press the foot control slowly and move your hands to the tooth. We will maximize the speed. Do it circular motion. Make sure it is deeply burnt. Or what I mean is deeply burned by 3 mm. Depth. Inspect the tooth if clean and observe its color. Observe the color of the enamel. So I apply the 3 mm depth here. Then we will proceed now into a thin layer curable calcium hydroxide. So where's the calcium? Here. Calcium hydroxide to protect the pulp. This will protect our pulp. So apply thin layer, just a thin layer. Thin layer. Thin layer. Okay. Thin layer. I already inserted the thin layer of the curable calcium hydroxide.
Then we will cure the calcium hydroxide about 15 seconds. Away from the composites, bonding agents that we're doing. So we already cured it for 15 seconds. Then the next thing we will do is to apply the application of the acid enchant. So we will apply the acid enchant 15 seconds. We're applying for 15 seconds. So then here's a mark here. There. This is the acid enchant. Now we will wash off this acid enchant. We will now wash off with water syringe the acid enchant. And here we will wait for 15 seconds. We'll gently air dry the tooth. After we wash the acid enchant. Gently air dry the tooth. And take note for the color change of the enamel. So next we will dispense the bonding agent. And the composite well. Here is the composite well. We will be using only 1 drop of the bonding agent. There. one is enough. Then, use the cotton applicator tip to apply the bonding agent onto the tooth. After the first application, we will gently air dry the bonding agent to let the carrier, which is the acetone in the water, to evaporate. And make sure that the bonding agent is spread out evenly. Gently air dry. Air dry. Yeah. As we can see, the color changes. The yellow. I saw yellow. Because of the bonding agent. Then we will apply the second layer of the bonding agent. Applied it evenly. Yeah. Then we will air dry it for 15 seconds. There we go. It's 15 seconds already. Then we will cure the bonding agent into for 10 seconds. We will cure the bonding agent for 10 seconds. Set your light cure into 10 seconds. Then there we go, the 10 seconds. So, we will now be doing, after we do the light cure for 10 seconds, we will inject the flowable composite onto the floor of the cavity. So here's our flowable composite fusion flow. Inject it into the floor cavity. But apply thin layer. Only apply thin layer. Apply thin layer. Thin layer. There we go. Then, after we apply the flowable composite, we will now cure it for 20 seconds. Make sure that it's neatly spread onto the wall of the cavity. So now we will proceed into the curing for 20 seconds now. Press the power button and set the light cure into 20 seconds. We will cure it for 20 seconds. There we go. The 20 seconds. So the last thing that we will do is to dispense the fusion packable composite here onto the composite well. We will use the plastic instrument to dispense the packable composite. Dispense just the amount. Just to increment the cost. We will be incrementing the cost per cost tip. Then we will cure for, there we go. I will show you the, here. Here is the packable composite. Then we will apply the packable composite to build up the clasp of the tooth. Little by little. Or what you mean incrementally. We will see that we will get the anatomy that is prescribed unto the 4-8. Little by little. Just little amount of to build up the cusp. But so we will gonna use this one to increment the cusp that we will observe its anatomy of it. There we go. There's the grooves. As we all know, there are 4 cusps here. So we will create the 4 cusps to the 4th root of the tooth of our 3rd molar. 4th molar for our patient's tooth. Creating the cusp and the grooves. We shall so here, we already put the packable composite. Now we will going to lecture it for 20 seconds. That's it. There you go, 20 seconds. Then light cure. Make sure that your composites are away from the light cure or the blue light. There you go.